Hi guys, Avi here from ProPhysio Plus. Today we are going to be talking about what is discogenic pain and what are the symptoms of discogenic pain. So please like this video, subscribe to our channel and share with your friends. Okay, let's jump in. So what is the meaning of discogenic? So discogenic is a type of pain which is formed in the low back or anywhere along the spine, mainly in the low back. And it's caused by chemically or mechanically damaged intervertebral discs. It commonly involves degenerative changes of the intervertebral discs. So of all the patients who are dealing with low back pain, it appears in studies that approximately 28 to 40% of these cases is usually caused by discogenic affliction. So what are the symptoms of discogenic pain? So normally you'll get pain with sitting for too long, difficulty or pain with forward bending, so going this way, muscle spasms in the neck or arms when you do something upper or lower body movements. That's if it's up, higher up. If it's lower down, it'll be more down the legs or the back, lower back. Pain in the affected area, weakness in the distribution of one or more lumbosacral nerve roots, increased back pain with coughing, sneezing, laughing or straining, numbness, pins and needles, and increases in leg pain with straining, coughing and sneezing again. And these will vary person to person, but these are some common symptoms if you have discogenic pain. All right, so a great test that we can do in the clinic that a lot of practitioners do is a straight leg raise test. This is to find out if they have any referral pain down the leg. All you got to do, you can even do it at home to reflect if you have more of a discogenic pain with referral pain. So I'm just going to lift up Lecky's leg and we're going to go up as high as we can. And then what we'll do is we'll compare both sides. Someone that doesn't have any positive signs, you'll be able to take both legs comfortably out with any issues. Someone that has a bit of a positive discogenic referral pain, let's say it's on his left side, I would lift it up and straight away he'd either feel like a real tightness in his hamstring or a pull or a pain in his low back. And as I wind it up, it gets worse and worse. And then you can play around with the foot position to target different areas of the nerve. That's usually a positive sign. One leg gets a lot higher up, the other one doesn't and has more pain and symptoms. Sometimes it can be on both sides. So that's a common test that we do. It's a straight leg raise test. You can even Google it and find more information, but that's something you can check out. Let's say you have positive results and you are having a kind of discogenic pain. What we can do for treatment is a simple respite position learnt from Stuart McGill. So what we'll get Lecky to do is just roll over on his stomach. So what you do, find a nice firm surface on the floor or on the bed and we're going to try to find a very comfortable position that deloads the spine. So we're going to start with both hands flat on top of one another under his chin and we'll see how this feels. And if he feels it's comfortable, no pain, it usually means he just has a flexion intolerance. He can tolerate a bit of extension. And if this feels good, we'll try to go up to the next stage, which is a closed fist. And yep, sitting under the chin, the other hand just resting. And we'll ask the question, does that feel better or worse?
Feels better.
If it feels better, then this could be his respite position. Then we could try going even higher. And then we'll go double fist, both on top of one another. And then we'll ask the same question. Does that feel better or worse? If it feels better, this is his respite position. If it feels a bit more worse, we'll go to whatever's most comfortable. And you don't normally want to go into too much extension, so lifting too high. This is probably the furthest you want to go, and that gives enough room by deloading the spine, but also any of the disc pressure that's being pushed out to the back due to the discogenic pain, it's just calming down and pushing back in. Lie in this position for about 3 to 5 minutes, then stand up and go do your everyday activities. And this is something that will help also alleviate the pain down the leg.
Okay, so we're going to put Avi in the hot seat with our most commonly asked questions about discogenic back pain. Either the questions we get in the clinic or straight off Google with the common search terms. So Avi, question number 1, what is the meaning of the word discogenic?
So discogenic is a type of pain that commonly forms in the low back or anywhere along the spine, and it's caused by chemically or mechanically damaged intervertebral discs. So it commonly involves degenerative changes of the discs. So of all the patients who are dealing with low back pain, it appears that in a lot of the studies, approximately 28 to 48% that come in of these cases is pain caused by discogenic affliction.
Yeah, so it's not Saturday night discogenic, it's a different type of disco. Okay, question number 2. So what are the symptoms of discogenic pain?
The symptoms of discogenic afflictions can vary person to person, but the patients that experience ongoing low back pain often report this pain radiating into their buttock and the leg. That's if it's coming from the low back. The pain can be experienced uni or bilaterally, can be on both sides, both arms or both legs. Prolonged sitting and bending can aggravate pain, and more common symptoms are listed in my blog post.
Great. So check that out, guys. More information in the Juicy blog post. Avi, question number 3, how do you treat discogenic back pain?
Discogenic pain is typically associated with activities that may increase the pressure in the intervertebral disc, causing the pain to worsen. So if you have pain with bending forward, sitting, sneezing, coughing, you may find relief when you lay down on your stomach, like discussed in my previous video, the respite position. And avoiding movements that load up the spine too much and maintaining a neutral spine throughout the day. And that can help deload the spine and assist with moving the disc pressure that's been impacted to move back to its original spot.
So you got to try and figure out, guys, what the nice movements are for your spine and what the naughty movements are. Okay, question number 4, Avi, how does discogenic pain ever go away?
So this will depend on the intensity and the severity of the discogenic pain. So however, most commonly the pain will subside on its own with conservative treatment. If the main cause is not changed, it can be very common for the pain to come and go all the time. So you may have the pain for a little bit, then all of a sudden it goes away, then it'll come back a few months, but every time it comes back, it comes a bit more severe. So this is normally if the movement patterns are not adapted for the intolerances and you have obtained because of the injury.
Okay, another common question here, Avi, how do you prevent discogenic pain?
So by not loading the spine directly too much on a consistent basis, so especially if you have discogenic, it's not commonly if you're bending forwards all the time and causing that slouch position, and you want to be avoiding bad movements and also adding in walking on a daily basis. That keeps the disc very healthy and well preserved throughout the day. So what I encourage is 2 to 3 walks a day, or even 1 walk, 15 to 20 minutes, depending on your time schedule.
Remember, this is a back pain, a specific type of back pain, discogenic back pain. So you got to make sure that you get your specific questions answered by your local clinician. And if you're nearby, come check us out at ProPhysio Plus.
Well, there you have it. We've laid out how you can identify discogenic pain and what are some strategies to improve the pain. So please let us know how you went with it. Please like the video, subscribe to our channel and share with your friends, and we'll talk to you again soon.